Consulting company, and I'm currently organizing the Colorado chapter for Docs for Patient Care. We're still in our infancy, haven't even had a meeting yet, so this is all brand new stuff. Well, I was going to tell you, I'm going to talk a little bit about how Docs for Patient Care formed, and then we're going to talk a little bit about some of the task force some of the task force screening mammography recommendations. The AMA used to represent about 70% of physicians, and over the years that's dwindled significantly. Now it only represents about 17% of physicians that are mostly academics, administrators, residents, students, and fellows. Sorry, it's not going backward? Oh well. I don't have the right touch. There we go. The AMA has a monopoly on publishing what we call a coding book. It's a book of numbers that say what different numbers are assigned to different patient or different disease states and entities, and then there's another book of numbers for billing codes for different services that we provide. So with these books, everybody has to use these books, every healthcare provider in the country, so you have 2 or 3 or 4 or 5 of them in your offices. And the AMA generates $111 million, I think that was a 2007, 2008 number, from the sales of these books. They have a government-granted monopoly on these books. They make $20 million now collecting membership fees and dues. So you can see there's a conflict of interest there. So when the AMA signed on to Obamacare, we feel strongly as physicians that they sold us out. Pardon?
Just like ARP did.
Bingo. Yes. Investors Business Daily conducted a poll from September to November of 2009. They asked physicians 3 questions. Do you support or oppose proposed health care plan? 65% of physicians oppose it. If Congress passes its health care plan, will you consider leaving your practice or taking an early retirement? 45% of physicians said they would consider retiring early or leaving. Question 3, do you believe the government can cover 47 million more people and it will cost less money and the quality of care will be better? We're as smart as the rest of the American people. 71% said, I don't think so. Hence, Docs for Patient Care. It is docs, the numeral 4, patientcare.org is our website. It was started by a group of 40 physicians in Atlanta. Their mission, we're an organization of concerned physicians committed to a healthcare system that preserves the sanctity of the doctor-patient relationship, promotes the quality of care, and supports affordable access for all Americans while protecting patient freedom. Imagine that. This is not just for doctors, this is for everybody in this room. Everybody can join and we encourage you to do so, please. There are 3 arms to Docs for Patient Care. One is obviously the physician's arm. One arm is for non-physician healthcare providers, nurse practitioners, nurses, technologists. The last arm is for patients, the most important arm. So these are all affiliates of this group, Docs for Patient Care, that we're forming. I think we have about 10,000 overall members and about 3,000 physician members right now. It was started last May of 2009, so it's growing quickly, and now we're kind of an exponential growth since the word is finally starting to get out. So please, everyone can join. Membership is free, that's the most important part. Except for the doctors, they're trying to hit us up for money now. Talk radio supporters right now, Mike Gallagher, Dennis Prager, Hugh Hewitt, Bill Bennett, they're all on KNUS. And although these are conservative talk show hosts, Docs for Patient Care wants everybody to know this is a non-partisan entity. Just because we oppose Obamacare doesn't mean we're conservative. We have libertarians, liberals, Democrats, everybody represented, and we want ideas from everybody. Everybody has ideas. Hal Schertz, one of the founders and the current president, has a great quote. This isn't about right versus wrong. This isn't about right versus left. It's about right versus wrong. Healthcare reform definitely affects us all. They've had rallies in Washington, D.C. and Atlanta. This is Hal Schertz, the current president, one of the founders. Facts, we've already been through some of these. The U.S. does have the best health care in the world, regardless of the ridiculous WHO statistics. Patients from all over the world come to the U.S. for their health care. No one has refused health care in this country. I don't care what stories you hear. Anyone who presents for care is treated. Nobody's turned away. There are lots of private funding agencies. Komen Foundation does a fabulous job. They have, especially in Denver, they have wonderful programs. Avon Foundation, one of our local doctors started the Raymond Wentz Foundation for cancer patients, and that's local. And there are just a laundry list of others. Every year, I think maybe people don't realize this, individual caregivers and hospitals give a lot of free care, billions of dollars every year in unreimbursed care and charitable care. We all agree that we need healthcare reform, as we've been saying, but not this healthcare reform. Other things that people may or may not know about doctors, what we charge and what we get paid are two very different things. We may get paid a fourth of what the charges show up on your insurance bill, and I'm sure most people now are getting enough healthcare in this room that see those bills, and you see that you're charged. The charge is $500, and the accepted reimbursement is $150. Yes. Those reimbursements are based on Medicare reimbursements that are issued by the government. Those reimbursements go down every year. For example, in the 1990s, when I finished training, we got paid probably about $1,500 for an MRI because it was still relatively new, still very expensive technology. It's still very expensive technology. But our reimbursement now for the same scan is $400. So it went from $1,500 to $400. And guess what? We're doing 10 times the number of MRIs that we were doing when we got $1,500 for it. So we're doing more money for less pay every single year. Malpractice premiums keep going up every year, and our risks of lawsuits keep going up every year. Every time there's a jury settlement or something and some new precedent is set, we have to readjust everything that we do, all of our regulations, all of our preparatory care, every consent form that we sign has to have another line in it because somebody sued somebody and won. More doctors are retiring every year than are graduating from medical schools. You do the math. 35,000 doctors leaving at this point. This is before Obamacare, before the 45% retired or quit their practice. Before Obamacare, 25,000 medical students are graduating every year. So we all agree the problems are access to affordable health insurance, increasing costs, and an out-of-control tort system. Prescription for reform, cute name. For access, we've already talked about a bunch of this, so I'll just review it real quickly. Insurance vouchers, tax credits for people utilizing private insurers, eliminating pre-existing condition penalty by establishing high-risk pools across the country and allowing private insurers to compete for the business. So that kind of addresses one of those. I honestly don't know the details of how that would be enacted. Allow people to purchase their own insurance. I think uncomplicated insurance from the workplace could be a great key. So that, exactly like you said, so people that have a problem while they're employed, they've got insurance, they lose their job or choose to go out on their own. Right now, it can be very difficult. Personally, I couldn't get a health insurance policy last year. I tried to get a personal one, I couldn't, and I hadn't even had cancer or anything yet. So it's a big problem. And to trying to keep the cost of insurance down, we want to promote competition in the private sector, like we've already talked about. Repealing some of the antitrust exemption that favors insurance companies is one necessary act in order for insurance to be sold across state lines competitively. Actually, reduce restrictions on internet sales, health insurance. We talked about extensively, great talk about HSAs. One of the things Doctors for Patient Care had a lot of discussion about, and we strongly endorse, is posting our prices.